It is Tuesday, so time to talk with Dr. C. Dr. C, thanks so much for coming back. Welcome back. Today we are talking about knowing your numbers, your cholesterol screening numbers. So what numbers should we be focused on and which specific ones should we know?
So we should know our total cholesterol. We should also know our HDLs, which refers to the high density lipoprotein. Some people call it the good cholesterol. And we also should know our LDLs, or the low density lipoproteins. Some consider them to be the bad cholesterol. And you also should know your triglycerides. And these are generally collectively gotten through blood work obtained from your doctor's office.
So how often should we have our levels checked when we go see the doctor? How often should we be doing this?
So the American Heart Association recommends that those over 20 get these drawn at least every 4 to 6 years, depending on those risk factors. So if you have risk factors for high cholesterol, such as a family history of heart disease, or personal history of tobacco or smoking, or whether you're obese or not, whether you have diabetes or high blood pressure, that may increase the risk at which frequency you may increase getting that blood work drawn.
Okay, so what exactly is cholesterol? I know sometimes I forget what it means. I know it's an indication of our health, but what exactly are we talking about here?
So cholesterol is simply a fat that is found in our blood. Your body makes cholesterol, so the liver makes cholesterol. But we also take in cholesterol by the things that we eat. So the red meat, the eggs, the dairy, the butter, those are things that will also have cholesterol. If you think about the good things, such as the fruit, the vegetables, the whole grains, there's no cholesterol in those things, which is why we, again, encourage those things when we're trying to lower cholesterol levels.
Of course, it's a very adult thing to talk about. What are your cholesterol levels? But is it possible for children to have elevated cholesterol levels? Is that even possible?
Yes. In fact, again, the American Heart Association recommends that children beginning maybe 9 to 11 have the first check of that cholesterol, and they may increase that again or check it again by the time they're in their late teens. There can be family histories that will indicate a higher risk. And again, as children get older or as the weight increases, especially with childhood obesity rising, so does the risk of increased cholesterol levels. And so again, it can still be present within children. In fact, there's been one study that came out several years ago in 2018 out of Boston that said that only 1 out of 5 young adults did not know they had borderline cholesterol elevations. And that becomes a really big deal, especially if you have to have a life where you are working to lower those cholesterol levels. If you're starting at borderline, you can only go up if you're not paying attention to it and doing the things that you can do to control it.
So how can we best control our cholesterol levels? I have a feeling you're going to tell us, cut down on the bacon.
It's certainly on the list, right? But there's some things that you can control and some things that you can't control. So you can't control your family history, correct? But you can control diet. We talk about having diets that are, again, high in the plants, those things that have zero cholesterol in them. So a plant-based diet is certainly, gets a lot of rave reviews when we're talking about lowering cholesterol. But if you're going to have some other things, thinking about eating the good types of fat. So we're talking about the avocado, if you're eating fish, the salmon, eating the nuts, those things that have the good type of fat in them, staying away from that saturated fat that you're going to find in French fries and the hamburgers. That's not going to be the type of food that you need to focus on. And plenty of exercise. If you're smoking, this is certainly another reason why you should quit smoking and trying to maintain a healthy weight. Getting at least 2.5 hours of moderate to vigorous activity every week. So that works out about, I did the math, about 21 minutes a day of moderate to vigorous activity, or you can also include about 10 minutes a day of vigorous activity. So that exercise will certainly help keep those cholesterol levels much lower.
Okay, turkey bacon it is, I guess we'll have to do. All right, Dr. C, thanks so much. Some helpful information once again. Thanks for joining us.
Thank you.